and other MHE members. If for whatever reason you prefer to remain anonymous, you can always ask your question in the chat box anonymously, and again, I will be happy to raise it for you. The presentation that you will see in the next hours will be shared with you, along with any other material that might be mentioned and might be useful. And I think that if there isn't any specific question about the housekeeping rules, I think we can start. So, well, welcome again. I think you all know me. I'm Laura. I'll be the moderator of the webinar today. And I'm joined here by Jonas, my colleague at MHE, and Alejandro, my former colleague at the European Disability Forum. We are here in the next hour to discuss with you and present you the new strategy that the EU has published on the rights of persons with disabilities. This has been in the process of being developed for over a year, and MHE has been actively inputting to it. You will hear more later on. For us, this is quite of a particularly important piece of work and EU initiative, as is the main instrument that the EU wants to use to implement the United Nations Convention on the Rights of Persons with Disabilities. And as we all know, I think the UNCRPD was signed and ratified by the EU and all of the member states. So it's an important piece of legislation that defines the rights and obligation of the state parties vis-a-vis persons with disabilities, including persons with psychosocial disabilities. This new strategy has been published less than a month ago, at the beginning of March, and will be in place for the next 9 years until 2030. In the next hours, we will hear first of all from Alejandro Moledo from EDF, the European Disability Forum, and he will give us a presentation that is more general on the strategy and its ambitions and its aims. And then there will be a moment for Q&A, which will be followed by a presentation by Jonas, my colleague at Mental Health Europe, that will look more into what's in for psychosocial disabilities. So it will analyze a bit more the strategy from the perspective of MHE, what we find useful and what we find a bit more challenging. And as well, this will also be followed by a Q&A session with you. So without any further ado, I will give the floor to Alejandro. This is the housekeeping. Yeah. And I think you will share your presentation, right?
Yes, thank you, Laura, and thank you very much.
The floor is yours.
Thank you, Laura, and thank you very much for the invitation. Yes, indeed, I will share my presentation and I will turn off my camera so I can read it well, but then I will turn it on during the Q&A if that's okay. So if you bear with me just a second, I will try to share if technology works for us. There you go. Okay, I think that's it. You can see the slide, right?
Yes, we can see it very well. Thank you.
Great. Okay, so I'll try to be brief, even though it's a big document full of commitments, as Laura was explaining. From EDF's perspective, after discussing the disability rights strategy with our members, we believe that this is indeed a promising and comprehensive document. And although, as we will see, there are still many question marks when it comes to how the Commission will indeed fulfill many of the actions of this strategy. We also noticed and valued very much that it's rooted in the UN Convention on the Rights of Persons with Disabilities. The previous strategy from 2010 to 2020 was adopted before the EU ratified the convention. this new strategy does give visibility to disability rights and persons with disabilities in many other EU flagship initiatives, such as the Green Deal or digitalization. And in that sense, that is helpful and will allow us for more impact on those different areas, so we can better mainstream the rights of persons with disabilities. But as I was mentioning before, the strategy lacks many details on how it will succeed in actually achieving the objectives that we will talk about in a moment. It also lacks funding on the implementation of the strategy itself and on the monitoring of the strategy. And we believe that this would have been very much needed to ensure that its actions and objectives are taken seriously. It refers to many other strategies in many of the actions that we will discuss today. The Commission basically points at other strategies, such as the European Digital Education Strategy, the Democracy Action Plan, Renovation Webs, and so forth. So in that sense, it's good, as again, to give visibility to disability rights in these other initiatives and strategies, but it doesn't add concrete actions on these aspects. And we see and regret that there are not so many legislative proposals when it comes to introducing new legislation, such as European directives or regulations and so forth. So, and actually, the ones that we see in the strategy, many of them were already planned, and we knew that they were going to happen, such as revisions of this and that directive that were indeed going to happen regardless of this strategy. So again, it's a very promising document, very comprehensive. It will give us reasons and to keep on working on different areas, but we'll need to make sure that the Commission and other EU institutions actually implement them in reality, in practice, so to bring real change to persons with disabilities. Very briefly, I just want to give you a bit of a taste of what kind of actions the strategy contains. As we called hard legislation, so directives, regulations, and so forth, there are many revisions of current legislation, but in total we count as 5 in total. There are new structures and practices and how the institutions behave when it comes to the rights of persons with disabilities. This is very positive. There are 14 of these kind of actions. Also quite a number of guidelines and toolkits. We count up to 10. It does refer to EU funding, not for the strategy itself, but some of the objectives and actions of the strategy are underpinned by EU funds. We counted 11 of these. It also provides a set of actions in support of member states and their national policies, up to 9 we count. And then it also includes indicators and ways of measuring and monitoring the strategy, which also we value very much. 6, we will discuss this in a moment. Well, there is also, I don't want to get take too much time on this, Commission research on specific issues. There are 14 mentions of this. Again, mentioning objectives through other strategies, 21. So you can imagine how many how many actions we see that, okay, we need more, definitely way more details on how this will be implemented in reality. Then dialogue with stakeholders, 7, and calls to member states to take action themselves, up to 20. Many of these are quite important, as for example, the situation when it comes to the anti-discrimination legislation that the Council keeps blocking. I will now touch upon the 7, as they call it, flagship initiatives in the strategy. The first one is to launch a new resource and knowledge center called Accessible EU. From the disability movement, we were calling for the establishment of a new European agency with more powers and responsibilities on implementing accessibility, but the Commission has instead go for this kind of softer approach. We'll see how it is in practice, in which they will bring together accessibility experts, obviously, and also representatives from the member states to discuss together on how to implement accessibility policies such as the European Accessibility Act, for example, and how to train experts and at national level on these policies. Well, the most known and let's say celebrated flagship initiative is the proposal, well, actually the action from the Commission to propose to member states. I mean, we still need the political will of member states to go forward, of the European Disability Card by the end of 2023. This, again, will be proposed to member states. At the moment, as you may know, this is just a pilot project in 8 European countries, covering fields of culture, leisure, and sport. And from the disability movement, we would like to see this card as a way to ensure the mutual recognition of disability across the EU. So persons with disability don't need to prove once again that they have a disability when they move to country. We'll need to see what kind of scope the Commission will propose in this action, and what will be also the agreement among member states, and see how far we can get. We believe that this should be linked to legislation, obviously. The third flagship initiative relates to independent living. The Commission will issue guidance recommendations to member states on implementing independent living and inclusion in the community, to enable the supported living in the community, in accessible communities, including through the provision of personal assistance. And we believe that this is a good proposal because it is actually very important that member states have a common understanding on what deinstitutionalization means in practice, and what living independently in the community means in practice as well. The next flagship initiative is about social services of excellence to persons with disabilities, to improve service delivery, and to enhance the attractiveness of this service provision for jobs in this area, to attract more jobs in this area through upscaling and reskilling of service providers. The next flagship initiative is about improving the labor market for persons with disabilities. There is a set of potential indications of what the Commission will have in mind in this package. But again, as you can see in all of these proposals, it's still not clear on what it means or what will mean in practice when the actions are proposed indeed. Guidance, support for mutual learning, strengthening capabilities of employment and integration services, promoting hiring perspective, ensuring reasonable accommodation, securing health and safety at work, and so forth. The sixth initiative is about to replace the current disability, the high-level group on disability, with a new disability platform, in which the Commission and other EU institutions will come together with the CRPD focal points at national level and with persons with disabilities organizations to follow the implementation of the strategy, obviously, and also to exchange information when it comes to, for example, the CRPD review of different countries. We don't know yet how will look like in the end this platform. It will be created this year. This platform, for example, will decide on the accessible EU center that I mentioned at the beginning, and but we are happy that in this specific action, the Commission states that there will be public information about this platform, because, for example, the current quality task force in the Commission, we don't know much about, although we know that it's working, but we don't know its members, we don't know when they meet or what are the outcomes of their meetings. So in that sense, it's positive that the Commission wants to be more transparent in this disability platform. The final flagship initiative is as for the Commission's obligations as a public administration, under the CRPD obligations, I mean, and this is to renew the human resources strategy that they have in the Commission to increase diversity in the workforce of the Commission, basically to introduce measures to ensure that more people with disabilities will be hired as European civil servants, EU civil servants, I mean, and this will also link to other actions as for the recruitment of public servants done by the EPSO agency, and also different campaigns and trainings internally to increase also diversity and understanding of human rights and persons with disabilities. The chapters, now I will go very briefly, I'm sorry, because I think this is taking long. So Laura, feel free to cut me off if you see.
Alejandro, we have time, and don't worry.
Okay.
I mean, I don't know for how long you need to speak, but for the time being, it's going all right.
Okay, good. So I will just mention not all of them, but some actions in all of the chapters or priority areas, as they call it, in the disability strategy. The first one is accessibility. We already saw its flagship initiative, this resource center. But also by 2023, the Commission plans to evaluate the assistive technologies market in the EU and see whether further legislation or initiative will be needed. And from EDF, we believe that this is actually necessary. Then, as mentioned, and linked to the Green Deal initiative of the EU, the Commission plans to enhance accessibility through the renovation wave of buildings, so to increase the energy performance of buildings in which we can include accessibility for persons with disabilities. Then by 2021, the Commission, so this year, the Commission also will also publish guidelines for public procurers on how to ensure that whatever they buy is actually accessible for persons with disabilities, as the legislation requires from 2014 already. Also this year, the passengers' rights regulations will be reviewed. We already had the rail passengers' right reviewed and adopted this year with an improvement when it comes to the rights of passengers with disabilities. And this year they will start with the revision of other passengers' rights. But again, we knew that it was going to happen this year. We move on to the next chapter, which is enjoying EU rights, in which the disability card and the work on mutual recognition of disabilities included. But the Commission also points out the elections and political rights of persons with disabilities. When it comes to ensuring accessible EU elections, the Commission wants to work with member states, obviously, because national competence are very strong in this particular field, even though the EU itself has competences when it comes to the European Parliament's election. And from EDF, we will keep on advocating for an amendment of the European electoral law from 1976 to ensure that people with disabilities, all people with disabilities, have the right to vote in the next European election. Currently, they are there are 14 countries in which this is not the case, and many more cannot vote because of accessibility. But the Commission wants to work with member states and with the European Cooperation Network on elections, and they want to issue a guide of good practices for accessible elections by 2023. We believe that this timing is not very strategic because the European elections will come in 2024, and maybe just to give one time to member states will not be enough for them to revise or amend their national laws on elections. There will be also high-level events on this matter, and the Commission also expresses the need for involving persons with disabilities in the Conference of the Future of the EU. We move on to the chapter on quality of life and living independently, in which, apart from the guidelines on independent living that we talked before, the Commission wants to, in the evaluation of the anti-discrimination directive on employment, they will assess if a further legislative proposal is needed to ensure and to strengthen the role of equality bodies that are not set up in all member states for the moment. This chapter also includes actions when it comes to young people with disabilities, for which they will use the funding of the Youth Guarantee. The Commission on Employment Policies will work through the European semester, which is, as you know, the economic and structural recommendations that the EU sends to member states, and these are actually one of the most influential let's say measures from the EU to specific member states. So it's good that there is a link here. The Commission will also launch the action plan on social economy in 2021, so this year, and in 2022, and a study on social protection and services for persons with disabilities. And they will keep on working and supporting member states in reform of their social protection systems, including on the disability assessment, because as you know, this is very much medical oriented, still medical oriented in many member states. On the next chapter, equal access and non-discrimination, and here we start with one of the, let's say, clear flaws of this strategy. The Commission says that they will work with member states to implement the 2000 Hague Convention on the international protection of vulnerable adults, but they add, and this is very important to remind everybody, that this is in line with the UNCRPD, and as we know, the Hague Convention is not totally in line with the CRPD. So it's very unclear to us on how the Commission will, on the one hand, promote the ratification of the Hague Convention, and then on the other hand, stress that this should be in line with the CRPD, but we will see. They will also launch a study on the procedural safeguards for vulnerable adults in criminal proceedings and assess the need for legislative proposal in support and protection of vulnerable adults in the victim rights strategy. Again, another mention to another strategy. I mean, the disability strategy is very good in linking all the strategies that ensures in a way that the Commission services work together, which is a positive aspect. And then on access to justice, they will keep on working on measures to support member states in making their justice system more accessible, in increasing that persons with disabilities will work as professionals in the legal system, in the justice system, and then in exchange good practices when it comes to supported decision making. This year, they will also publish a toolkit on the inclusion of early childhood education and care when it comes to children with disabilities. I continue on equal access and non-discrimination because this is actually the longest chapter. They will evaluate the patient's rights cross-border healthcare directive, and by 2024 they will publish guidance, guidelines to member states and practitioners on including police officers on improving support for victims of violence who are persons with disabilities. They will invite the Fundamental Rights Agency to examine the situation of persons with disabilities living in institution in relation to violence, abuse, and torture. We've seen some serious cases during the COVID-19 pandemic. And also regarding COVID-19 pandemic, one of the actions that explicitly mentions mental health is that they will support stakeholders to address and alleviate the burden caused by the COVID-19 pandemic on mental health. But they don't specify, again, how they will plan to do this. We'll need to see and ask the Commission. Then the final chapters, I will go more quicker on those, promoting the rights of persons with disabilities globally. This is related to international cooperation and the role of the EU in third countries. They will improve the data collection in the humanitarian aid actions through the use of the Washington short set of questions. This is very good. They will also include the CRPD, and this is also very, very good and very influential in the generalized scheme of preferences, which is basically the kind of framework that they use for the trade agreements. And you know how important are international trade agreements for the EU and for third countries. So the UNCRPD will also play a positive point on those trade agreements in the discussions, of those trade agreements. This year, the Commission will also update the toolbox on the rights-based approach, for international cooperation, and they will keep on using and more systematically the OECD disability marker, again, to keep track on what the EU money is used outside the EU, how it benefits persons with disabilities in third countries. Then the final two chapters are dealing with the governance and monitoring of the strategy. On delivering the strategy, something that we found very positive, but it's not as good as what we were actually proposing, which is to establish CRPD focal points. But they say that all Commission services and all EU institutions should appoint disability coordinators. This will be important for us, for advocacy organizations, to have a clear, let's say, contact point that we can reach out in case of need or in case of our campaigns. And we hope that these disability coordinators will be publicly available as well. No? They will organize high-level meetings with the other institutions. This goes, I guess, without saying. But anyway, then also very important, and I think this is also a very good proposal, they will reinforce the role of the CRPD in the better regulation toolbox, which is the kind of set of rules and procedures that they use internally in the Commission to assess new proposals internally. So it's good that the CRPD has a higher presence in those kind of discussions internally in the kitchen, let's say, before they launch proposals. And then they will support member states, as they claim they do now, on implementing EU funds in compliance with the CRPD. So to respect accessibility and non-discrimination conditionalities, and to not to fund the use of EU funds, in segregated settings, for example, or an exclusion. On the Commission, on leading by example, which is again.
To interrupt you, I was wondering if you have many other slides to present.
No, these are the only two ones.
Okay. So okay. Yeah. So then, if you could come to a close, I'll pass then the floor to Jonas.
Okay, I'm sorry. Maybe I was over ambitious in adding actions.
There are things to say, so don't worry.
Thank you. No, I'll go very quickly. This is basically related to the obligations as public administrations, and as we saw, the flagship initiative is this Renew Human Rights strategy. They will also publish an action plan on web accessibility. They commit to have all their buildings accessible by 2030. And as mentioned before, they will launch campaigns and trainings for the staff, which will be mandatory. This is good, on diversity and persons with disabilities. and they will conduct regular screenings on recruitment. So they will assess whether these targets for diversity are actually met. This is good. This chapter, when it comes to their obligations, is very positive. Then the very last chapter is relates to awareness, governance, and monitoring the strategy, which is also quite positive because this year they will publish the monitoring framework for the strategy, for the implementation of this strategy, and they will work on disability indicators. That's something that we've been calling for in many occasions. They mention in the strategy children, employment, education, social protection, poverty and social exclusion, the living conditions of persons with disabilities, their health, and the use of new technologies. And they will want to link this, which is also very important, and we will need to help the Commission in achieving this in the social scoreboard. In 2024, and this is very important for all the disability movement at European level, they will assess how they've been progressing with the disability strategy, and if necessary, and this is when we will come all together, to update its objectives and actions. So by 2024, we can propose follow-up actions if we see that some of the objectives of the strategy are actually not met. And then, well, again, yeah, they will keep on working on a strategy on data collections that will also be promoted among member states. And I will leave it here. I'm very sorry for taking more time, but there is, as you can see, a very comprehensive document, and I'm available if you want to discuss anything in particular. Thank you, Laura. I will turn on my camera now.
Thank you, Alejandro. I didn't receive any question in the chat. I was wondering if someone would like to take the floor to ask a question. Otherwise, I will pass the floor directly to Jonas. I see that someone would like to speak. I'm trying to give the floor, but I can't. Maybe Jonas can help me here.
Yeah, I think I'm the one who can do it.
Okay.
I have the power. So I have here Andrea, I think you raised the hand. I'll try to allow you to talk. There you go. I think you can unmute.
Okay.
Great.
Yes. I will ask you, when you are talking about the disabilities and chances to vote in some countries, you mentioned 40 countries in EU, when the persons with disabilities can't vote. If you think about the interpreters for persons with mental health problem, or in these countries, or just the people with physical disability.
Do you want me to answer now, Laura, or?
Yeah, if you don't mind, because I think for the moment it's the only question that we have.
Okay, it's good that you asked me this question, because I'm actually working on this campaign in EDF. So there are indeed 14 member states in which particularly persons with intellectual and psychosocial disabilities are deprived from the right to vote. And so, well, and many other persons with physical or sensorial disabilities cannot vote because of accessibility barriers. But when it comes to the right to vote, to cast your ballot, that's not possible because of legal capacity laws at national level discriminating against persons with disabilities. And we've seen before the EU institution that there was some positive changes in some countries, in Spain, France, Germany, Denmark, but we still see 14 countries, and in total the estimated number is 400,000 people with disabilities who simply cannot vote, and this is not acceptable shouldn't be acceptable for the EU. So we are working with the European Parliament to propose a resolution to change the European electoral law from 1976, which will need to be adopted also by unanimity in the Council. This will be the difficult part. And we hope that they will change their competence at their competencies level, so they change this situation as for the European Parliament election. But we hope that if the EU kind of forces or agrees member states to ensure the right to vote to persons with disabilities at European level, so for the European Parliament election, they will also change their national and regional and local elections as well. So we hope that this will create a spillover effect, a positive spillover effect. So this will be it, and it's good that the Commission included some actions in the strategy to raise this issue.
Thank you. Great. Go on.
Thank you.
I don't think there is any other question. So at this point, I would pass the floor to Jonas.
Okay, thank you so much. I'm going to try something. I'll try to share my screen. I'm not sure if it works, so please let me know.
Otherwise, I can do it too.
Because I, as usual, have technical issues.
Oh, no, we can see it very well.
Can you see this? Okay. Yeah. Great. I'll try to be brief. Let's see if it works. First of all, thank you so much, Alejandro, for joining us today, and also for giving me this really comprehensive overview. I think it was, I mean, we could also interpret it as a very good sign because it's a very big strategy with a lot of objectives, and I think they're really, really worth looking at. And also regarding the last question that was just raised, I will briefly touch upon that. It's also in my presentation, but sort of, but I guess it's a really important point and we can touch upon it later. So the second part of today's talk or discussion with you guys is really looking at the strategy and trying to sort of include sort of the perspective of persons with psychosocial disabilities, sort of trying to put on a little bit the lens of what the strategy means and includes for persons with psychosocial disabilities. I'll try to move on here. Voila. So just briefly, what I'm aiming to do with, or what I'm trying to present in the next minutes is really just to give you a first impression of the strategy itself, how it sort of makes references to the situation of persons with psychosocial disabilities. And then, and Alejandro mentioned it already, there are a couple of chapters or priority areas, and I will try to look at some of them in more detail and to see how some activities were included in those priority areas. So in particular, on political participation, we touched upon it a bit, on deinstitutionalization, and the main focus is also on priority area 5 or chapter 5 on equal access and non-discrimination, in particular the Hague Convention. So I'll dive into this a little bit more and try to disentangle it a bit further. So once again, Alejandro mentioned it, sort of, I guess the different activities that we can find in the strategies can be, as you said, sort of at some, I mean, in some way considered as a kind of type of action, a legislative action, a toolkit, guidelines, etc. The Commission, when it presents also the strategy, also uses sort of the, or going along the types of action per actor. So as you've seen, there are a couple of flagship initiatives, some important objectives by the Commission that it really focuses on. Then we have some Commission actions, and then we have the cause for member states. It is mainly also due to questions of competency between the EU and the member states. Also with regards to, and sort of as a little reminder, also the European Union as such ratified the UN Convention on the Rights of Persons with Disabilities. So what I will do now is I will dive into these 3 chapters a little bit more in terms of enjoying EU rights, then decent quality of life and living independently, and then equal participation, non-discrimination, sort of as a core focus, if you like. And just sort of when reading through, and I sort of tried to include the original text and sort of highlighted it with some colors so that it makes it a little bit easier to follow. I think it's quite useful because some of you might have followed the previous strategies, or the strategy from 2010 to 2020, and its sort of final evaluation of that particular strategy. There were a couple of very positive remarks of what that strategy achieved. There was one key remark, although also that said that there was kind of, or the situation and the role of people with so-called invisible disabilities, including intellectual and psychosocial disabilities, might have not been taken into account to such an extent. And so when reading through this new strategy, the new strategy 2021-2030, we could overall say there's a much more comprehensive approach from a psychosocial perspective. We can see that it uses the common definition of disability. It includes the interaction of mental impairments which interact with environment, so pretty much the definition that we see also in the UNCRPD. And then it has some specific references to the situation of persons with psychosocial disabilities. One, we touched upon it before, was the question of legal barriers, or the question of how and when are persons with psychosocial disabilities deprived of their legal capacity to a full extent or to a partial extent. So that is mentioned specifically, and it also mentions sort of the fact that community segregation still exists, or still is there, and that is mainly due to the insufficient provision of appropriate community-based services, in particular, or including in the area of mental health. So we can see really here that it takes a much more holistic approach. It also is more holistic when we think of intersectional perspectives, so going across different identities and dimensions, and sort of it promotes this sort of intersectional perspective across identities, gender, racial, ethnic, sexual, and religious, or in a difficult socioeconomic or other vulnerable situation. And once again, at the end, emphasizes that groups requiring particular attention are women and persons with psychosocial disabilities. So that is just the first sort of impression that we get from the strategy when reading through. When going and now diving into the different chapters, we had the first, or the chapter that Alejandro mentioned already, on enjoying EU rights. One is the flagship initiative on the disability cards. The other one is really the focus on political participation. I'll try to be brief because we touched upon it also in our question, but I think it's important to remind ourselves that this is one clear ambition, so that the Commission will work with member states to support full electoral participation accessibility of the European elections. And I guess the interesting element in this is full electoral participation accessibility. And that includes, as Alejandro mentioned, sort of the question of legal capacity issues, usually issues that are dealt with on a national member state level. And through the strategies tries to disentangle that further and to say, when it comes to the European parliamentary elections, what can be done, for example, the revision of the code, that all persons with disabilities can fully participate in the elections. And that includes the removal of legal barriers for sure. The practice we mentioned already, that is prepared until 2023, so I will not go into that any further at this point. Moving on to the next chapter, and chapter 4 on decent quality of life and living independently. Obviously, a clear or a central focus of this chapter is the element of deinstitutionalization. We have the flagship on issuing guidance, recommending member states on the improvement of independent living and inclusion in the community. But we also have a call, right? So one of these interesting calls to member states to implement good practices of deinstitutionalization, specifically in the area of mental health and in respect of all persons with disabilities. So here's a very clear reference in terms of deinstitutionalization in the context of mental health. So that's interesting for us, I guess. And so we'll probably monitor that further. But what I would really now, with the remaining time, like to dive in with you is sort of this priority area 5 or chapter 5 on equal access and non-discrimination. And I'll start. I think, and a little bit as a recap, let me put it this way, in the European Union, as well as now all other member states, have ratified the United Convention on the Rights of Persons with Disabilities, therefore commit themselves to the full implementation of the obligations. At the same time, there's the challenge of competency. And we have one clear question or questions of competencies arise in the field of autonomy and equal access. So we have one subchapter in this chapter 5 that focuses on equal access to social protection and healthcare, education, goods and services, including housing. So you notice there's no mention of employment in this subchapter. That is because we have the Employment Equality Directive from 2000, which is about to be reviewed. Also, it's also a target of the strategy, but basically says there we have already a legal framework that prohibits discrimination on the basis of disabilities in the context of employment. Now, Alejandro mentioned it already, this subchapter focuses once again on the so-called horizontal directive, so sort of a general directive on equal treatment and non-discrimination. There have been challenges since, mainly sort of blocked by the council, of moving forward with this proposal. Nevertheless, it's included in the strategy and has been sort of emphasized that this is a clear issue to follow. And also hearing that, for example, von der Leyen last year, but also the Commissioner for Equality, Elena Dalli, saying that there's a need maybe to seek alternatives to the proposal on the horizontal directive in order to move forward with this more bigger legislation. How that takes place, we don't know yet, or it's not mentioned in the strategy. Then also in subchapter 5.4, we have a focus on sustainable and equal access to healthcare. And then Alejandro mentioned already, there's a clear ambition by the Commission to support stakeholders to address and alleviate the burden that the COVID-19 pandemic imposes, and that includes the mental health of European citizens. So really taking into account the COVID-19 pandemic and connecting it to both physical and mental health issues. Then another subchapter that we have is on ensuring safety and protection. I think for us, a very important one when we think about moving towards ending coercion in mental health, the questions of freedom from coercion, etc., something that we've been working on for quite a while. And here we have the very clear target or ambition that the Commission invites the Fundamental Rights Agency to examine the situation of persons with disabilities living in institutions in relation to violence, abuse, and torture. And this includes then obviously also psychiatric institutions. Then this subchapter also takes into account the field of migration and asylum. So when we talk about safety and protection, and makes a lot of cross references, some of you might know it, sort of the revision of the new pact, or sort of the revision of European asylum systems, especially with the new pact on migration and asylum that came out in October last year. We provided some input on this, and this sort of takes a particular focus on the specific needs of so-called vulnerable applicants. So also here, sort of a cross-reference to the field of migration and asylum. Then we have the subchapter on access to justice, and that the Commission will provide guidance to member states on access to justice. Also, little teaser, if you like, 2 weeks ago, we published the first reflection paper on what access to justice and legal aid could mean for persons with psychosocial disabilities, with some sort of promising practices that we can observe in the member states. There are a couple of references. So when you look at the second element here, assessing the need for legislative proposals, strengthening the support and protection of vulnerable adults who fall victims of crime, This is kind of a cross-reference to the victims' rights strategy, that also a new strategy by the Commission that emerged last year, and we're also involved in with the victims' rights platform. And then finally here, we also have the collection of good practices on supported decision-making, also interesting for us. And then I'm sort of moving into the sort of concluding slides and the concluding elements. I think I would like to spend the last minutes a little bit more on this very specific activity and this specific objective, and that is also under access to justice, that subchapter, and that the Commission will work with member states to implement the 2000 Hague Convention on the International Protection of Vulnerable Adults in line with the UNCRPD, to pave the way for its ratification by all member states. Okay, so this is an objective within the strategy. Now, many of you might ask yourselves, what is the 2000 Hague Convention on the International Protection of Adults? Well, to make it short, this convention is in a sense a legal document that is drafted by the so-called Hague Conference on Private International Law, and in a sense tries to harmonize and regulate basically, or build bridges, as it's called, build bridges between the different legal systems that we can find. So it tries to, for example, determine jurisdiction, which court is responsible, which law is applied in the case when we have, for example, in this case, adults that cross borders. And this Hague Convention, and you can see it in the Article 1 of the convention, applies to the protection in international situations of adults who, quote, by reason of an impairment or insufficiency of their personal faculties are not in a position to protect their interests. This is furthermore explained also in the explanatory report from 2017, where it goes basically or tries to disentangle and explain that convention document and has a specific reference to health, and says that the scope of the convention also includes situations where a specific adult is placed in a particular care institution, and we also have a subparagraph on public safety that concerns the confinement of adults who, and this is all from the report, quoting it, and it concerns the confinement of adults who are a danger to third parties by reasons of their mental disorders from which they suffer, end quote. And this is, I guess, an important element to bear in mind when looking at the explanatory report. And so therefore has very clear references to the work around legal capacity, to the obligations of the CRPD to move towards supported decision-making regimes, etc. And maybe I'll just stop here, and I'm happy to dive into the discussion. So as a conclusion, I think we can say this is a real, I think a very central document. It's extremely comprehensive, much more than we could say than the former one. I think we have to, and Alejandro mentioned in the first slide also, I think it requires more interpretation of competencies. We don't have a clear reference to ending coercion in the context of mental health in the EU. We have the investigation by the Fundamental Rights Agency, but it's not clearly addressed. And we have that sort of kind of, we could call it questionable objective on the 2000 Hague Convention that potentially could put the UNCRPD realization, especially in the fields of autonomy, at I guess, at some risk. And on the right, I just sort of included the concluding observations by the CRPD committee that it made to the EU in 2015 when undergoing the review process. I might just leave it here, I guess. Thanks.
Thank you, Jonas. In the meantime, some people have to leave, and I see that we are getting some comments. I mean, I think that there is the first one from Ferran Blanco Roa. I think it's more of a general comment where it states that it seems that the strategy seems to suggest that some of the recommendations that the EU received from the CRPD Committee on Legal Capacity have been taken into account, although this it might be a bit what is being promised is a bit falls a bit short, so to say. And I think this is, I mean, I don't see a question here. I think it's more of a general comment. And then I see Irina. Well, first of all, she thanks Jonas, and before she already thanked Alejandro. And she's asking whether the strategy text mentioned anywhere whether, sorry, I see that there are, whether a fail to comply with its recommendation will lead to any sanction from member states. So whether this is foreseen in the strategy. And I'll stop here. I mean, there is another question from Stefan, actually, sorry, that is wondering whether there is any reference to ending coercion in the EU in the strategy. And then I'll leave it here and I'll read the question from NDMR later.
There's the button. I'm wondering, Alejandro, if you want to add something on the question around sanctions. I guess I could start. I guess the recommendations of the strategy obviously are general. It depends then obviously if and I think it was said at the beginning, there are not so many provisions in the strategy that include hard legislative proposals, and I guess those hard legislative proposals would come potentially also with some form of sanctions, but I would not go as far as mentioning sanctions. I guess in this strategy, it's not so much about the sanction element. It's really the encouragement, sort of setting the frame, and then also supporting member states and moving on with those objectives, but also with national objectives or national plans on implementing the UNCRPD.
And then for the part on coercion, I guess.
Yeah. I can take that quickly. I personally was a little bit surprised too that there was not such a clear reference. We have the focus on institutions very much. The investigation clearly sort of indicates that the situation of institutions could be troubling, could, or has serious human rights concerns. I think some of you might know the Disability Rights Monitor that sort of monitor the situation of institutions during COVID-19 and sort of the human rights issues that arise from that. But as you know, for the field of mental health, coercive measures go beyond the institutional level. We could think about community treatment orders. We could think about other elements. They have not been addressed specifically, and I'm not 100% sure why that is the case. Yeah.
And then I see also Mary would like to ask a question. First, I will ask the question from Valentina from EMDR Europe. I'm sorry, before I pronounced the organization actually wrongly. So it's EMDR, which is a type of therapy to support people overcoming certain types of trauma, for your information. And the question from Valentina is, given also the current impact that COVID is having on mental health of many people, not only people that already have social disability, how can stakeholders use the strategy to collaborate together and also at the same time implement the strategy? And maybe to save a bit of time, we could give the floor also to Mary, so she could ask her question and you could answer both of them. But I think here, I think it's Jonas, no, that you have to give the floor to Mary.
Sorry, let me, what I'm going to do is I'm going to stop sharing so I can see you also. Yeah, I can see you. Hang on. Mary, I'm going to unmute you now, I guess. I hope it works.
Hello? Hello?
Yeah, hi, Mary.
Okay, hi. The it's interesting as somebody who is now living and working outside the EU, but it was still, there was a bit about international relations and stuff, and about how you could promote this way of working to other governments, other ex-member states or current member states. That was interesting. But the thing that really I thought was interesting about the Hague Convention, I'd never heard of the Hague Convention, and I wasn't sure whether, I've just written a question actually, whether it only applies to the EU or does it apply to the Council of Europe, and hence the thinking of the Bioethics Committee, because it's just horrible what it says about people being violent or could be violent just down to their disability. I think it's, I was distressed. But I don't know where it applies or who did it or why, or yeah, that's all.
Thanks, Mary. This is a really important point, actually, and I think it's important to emphasize. So the strategy obviously focuses on the EU priorities. It has chapters on international cooperation that Alejandro mentioned also. This Hague Convention that you mentioned is not designed for the EU as such. It is by this Hague Conference that invites, I don't know how many there, but loads of member states across the world to take part and sort of ratify those different conventions. We have, I think, almost 40 conventions that were drafted by the Hague Conference to regulate and harmonize private international law. I think even China, for example, is member to the Hague Conference. So it's really a multilateral global initiatives. And now in the strategy, obviously, is addressed by the EU as such, and trying to sort of pave the way, as it says, pave the way towards its ratification. But it's not limited to the EU.
But I don't think you want to ratify it, do you? Because if they won't do the UNCRPD, which is international, United Nations, why have this Hague Convention separate to United Nations?
Yeah,
I wondered.
It's a fantastic question, and we're trying to investigate a little bit further how this came about. I am sure that the so maybe just to give a little bit of a recap also, EDF, Mental Health Europe, many other organizations have been also invited to provide input to develop this strategy. And I guess we can see also a very strong fingerprint from civil society in this, which is good, I guess. I've never heard anyone sort of recommending the inclusion of the Hague Convention in the strategy. So we are also trying to find out how this came about. There was a conference that took place yesterday by the Portuguese presidency, which is currently having the presidency at the Council at the European Union, that was focusing specifically on the protection of adults in the international context. And there were a couple of sessions around this particular Hague Convention. As far as I know, no disability rights organizations have been invited to speak and to take part, and also to share their views. The argument that usually comes is that, and if you read through the convention and the report, it kind of says that it makes references to the CRPD, and sort of it aligns itself with the obligations of the CRPD through the basically an emphasis of the procedural elements. So what it tries to do, it harmonizes sort of jurisdiction, who is responsible, which law applies, but at the same time takes this sort of an old model of disability that is based on impairments, on incapacity, as I mentioned it, or phrase it also, as the fundamental understanding. So it's kind of a challenge to combine that sort of adhering to the CRPD obligations and at the same time promoting something that could harmonize legal situations that we find across Europe that are not in line with CRPD in terms of full legal capacity. So I think this is quite a concerning part. Yeah.
I saw that Alejandro was agreeing with you, I think.
Yep.
Because was this a bit of a surprise to find this in the disability strategy?
Yeah, very much. As Jonas mentioned, we didn't expect this to be included in the strategy. We've been in all the consultation meetings in preparation of the strategy. We've been very active also in the European Parliament, which adopted a resolution on what the MEPs, the members of the European Parliament, would like to see in the strategy. Nobody mentioned this, so we don't know how it ended up in the strategy, and we are also very eager to know how the Commission will work on paving the way for this ratification at the same time that they claim that this should be in line with the convention, with the UNCRPD. So we'll need to be very vigilant and be more vocal in discussions such as what Jonas mentioned, like happened yesterday, and there was no disability organization present. So we'll need to work with the Fundamental Rights Agency, with the Commission, try to figure out what is the end game here with when it comes to the Hague Convention and the CRPD, how they can combine these two.
Because it does seem to link to this horrible psychosocial disability with the Avedo Convention, Avedo Protocol for the Bioethics Committee of the Council of Europe, which seems to have picked up on this Hague Convention. It's very odd to me.
Personally, I think that the old regime is still there and still tries to set up this kind of parallel conventions and protocols and stuff. Like they are not really embracing the paradigm shift that the UNCRPD pushes for. So yeah.
Well, at least you're on the case, both of you, all of you.
We are.
Is it feeling a bit oppressive? It's very good, wonderful things, and then yeah. Thank you.
And maybe taking this link on what it can be done vis-a-vis the content of the strategy, I was thinking that maybe we could also go back to the question asked by EMDR Europe. So how can stakeholders like us collaborate to implement the strategy? How can this be used by organization on the ground?
I think that on that question, as we mentioned, there is this specific action to involve and support stakeholders on the burden caused by COVID-19 on mental health. But unfortunately, no much detail was included in the strategy. So something that we could do in the short term will be to question the Commission in the disability platform that will be created this year and ask how these and other actions will be actually implemented. But I believe that the work of EMDR will be very very relevant for this specific action and others. So definitely we will need to get more information, and there will be possibilities to participate. I mean, unfortunately, we cannot. We don't know them yet. So, but they will be clear hopefully soon.
I'm not sure if Jonas would like to add something. Otherwise, we can see if there are other questions.
I just wondered, just to talk about COVID-19, which obviously does have, but it's placing it as part of a pandemic as opposed to generally. You know, disability is affected by the pandemic like everything else, but it's to get away from that focus just on the pandemic and how when people have been trying to live their lives before and after, it just, I can see why it was there, because when the strategy was being devised, it was very much at the top of everybody's heads. But it's taking it into a particular context rather than the context of living one's life as one wishes to live it, sort of thing, I think.
Well, the strategy doesn't have, actually, I actually heard the opposite criticism to the strategy, that it doesn't have enough actions tackling the impact of COVID on persons with disabilities. The strategy includes a few actions, such as this one that I've just mentioned, but it does not, I mean, it's a strategy for the 9 years to come, so it doesn't focus very much on COVID. It includes, obviously it takes into account the impact of COVID, but it doesn't have, let's say, a cross-cutting COVID perspective throughout the strategy. It has some actions that specifically tackle the impact of COVID, and this one on mental health is one of them.
Okay. As long as it's just not that, it's far more than that. Yeah.
Well,
okay.
hopefully this pandemic will be over soon, hopefully.
Who knows? Okay, I must shut up. I will mute my.
I don't know if someone else has question. For the moment, the chat is silent. I'm not sure. I also don't see people wishing to take the floor. So I'll ask Jonas and Alejandro if they would like to add one last remark. Otherwise, I think we can close the webinar here.
Well, I think the main conclusion is that we have still, I think, as somebody mentioned in the chat, like we have still a lot of work to do, and let's keep on working together, because there are many things that will need our inputs. And if as Jonas mentioned, the disability strategy has a clear fingerprint on the meaningful involvement of disability organizations in the preparation, I think this commission understood the importance of involving us in a meaningful manner. So let's hope that they continue doing so, and we should, in any case, continue being active and vocal and keep on advocate for the implementation of the CRPD, as we always do.
Yeah, exactly. Actually, I don't have a lot to add to this. I think, yeah, the fact that there is such attention by the Commission to listen to civil society stakeholders is something that we could capitalize on. I think I guess also we could capitalize more on, especially thinking of the input by EMDR. And I think for us, it will be important also now to maintain the communication with the members, to see how we can feed some recommendations and give some input to the Commission, and how to see sort of the implementation of the different activities, and also to stay alert when it comes to some specific activities. Yeah, and I think it's important to bear in mind that this is really sort of a strategy for 9 years. So this is quite a long period. There's always the excitement when we get started with the strategy, and I think it's important to maintain sort of those objectives also over the next 9 years, really. So I think there's some way to go. Yeah. And
well, before closing, I would like to thank Alejandro for joining us and his presentation. I would like to thank Jonas, who was the main one who organized this webinar. So not only for his presentation, but for the whole work behind it. And also for the work in the past month to ensure that the new strategy would have certain elements in it. And on one very last note, I would like to remind you that the second week in May, from the 10th to the 16th of May, is our annual European Mental Health Awareness Week. In a few days, we will update the website with the different activities that we are planning. Spoiler alert, there might be a specific activity on coercion and community-based services. So you might be interested in keeping an eye on that and joining it. But there will also be more activities. So you will receive the information, but I really invite you to keep an eye on our website and to also join the week. There will be also tips and recommendation on how you can be active during that week. I would like to thank everybody, the participants, the speakers, those who took the floor and asked questions, and also those that just listen and participated today. And we will share with you all the relevant information very quickly. So thank you very much, and see you soon, hopefully.
Thank you. Bye.
Bye-bye.
Bye.